everybody, this is Aiden Wolf signing in from the great state of Texas, Arizona. And if you say it's not a real place, good for you, you're correct. Well, today's topic is about an awesome vet clinic by the name of Dr. Weldy's. And, well, enough said. Let's go there right now. Well, we're finally here at the vet's. So, now that we're here, I say we just go interview some people. See what they do.
Oh, yeah. This is our treatment room. So we have fully digital x-ray system. So unlike old film stuff, so like this is the dog that I saw yesterday, big German Shepherd. So the x-ray machine takes the picture and it puts it up here on the computer. The nice thing about it, you can change the brightness of it. I can zoom in. We can look at actually like the food here inside the stomach. You can look at vertebrae, the back side of the heart, that kind of thing. So really nice having this digital system. This is an ultrasound. This unit, it's pretty high quality. It's probably $45,000-$50,000 unit. X-rays help show you bones. I mean, if you have like a broken bone, so it can show you kind of the overall what the organs look like, where they are. You can see bones, but you can't see specific things. So I'll show you here. Turn it this way, you can see the actual bands of muscle here, and this is all in real time. So we can use that to look at different organs that will come in here. So, cat room, the dental room. So cat's that had surgery today. Are recovering here. Same like with the dog suite, but we try to keep the dogs and cats separated, just as cats don't like loud barking dogs. Their stress level goes up, which then makes it harder to anesthetize them, harder to keep them pain-free. This is our large animal bay. We have a stall there as well. We're kind of remodeling around here, so it's a little more clustered than normal. But if we have to have a horse come in, we can put him in the stall there. Normally this doesn't hold cardboard boxes, but this is a set of stocks. So you can load a horse in here. If we need to float teeth or something like that, we can run a rope through there and hook it to their halter so it holds their head up while they're sleeping, so we can float their teeth.
You're a teacher.
And these are a lot of our large animal supplies. You kind of, once you get used to working here, you know what you need on different species. But I mean, there's like rumen magnets for cattle, different things for detoxification. All of our
How many years you been teaching?
Oral medications, injectable medications, these are all of our vaccines, big bottles of penicillin. These are all of the things that need to stay refrigerated. Both here and then all this large animal vets, we have a truck that we drive around in to go out to farm calls. And of course you have to keep these things refrigerated. They're on your truck. Pills for anything and everything. Our needles, syringes, gloves, and you can imagine we go through tons and tons of that stuff.
What are some of the services you provide here?
Quite extensive. As far as just general medicine goes, we'll basically take care of animals from the moment that they're born. We do C-sections here to the moment they die, 10, 12, 15 years of age. And most of the things in between. We're pretty progressive general practice. There's some things that we just can't do. We don't have the equipment for it or the training for it. So, but there's specialty hospitals like the vet school at Purdue, vet school at Michigan State. There's a place called Knives in Fort Wayne. It's a specialty hospital. So if you have a dog that has a specific heart problem, you can send it there to have them worked up by like a cardiologist. But as far as services go, vaccines, general day, vaccines, ear infections, urinary tract infections, infected skin, spay, neuter, declaws. I mean, we can do just about anything.
So you were talking about before that when you become a veterinarian, you could theoretically do anything to any animal that comes in.
Yeah, technically I'm licensed to do it now. Do I have the knowledge to do that? Not necessarily, and all that comes with experience. It's could I In theory, could I perform surgery on a tiger? Yeah, I mean, I know what the anatomy, I know the general anatomy, I know my surgical techniques, but am I more qualified than a zoo veterinarian? No.
Probably.
No. Those people have especially the zoo veterinarians, another specialty. So you do an internship and a residency in zoo medicine, and you're now qualified to work you're a specialist in zoo animals. And those people are crazy, I mean, with the amount of things that they have to know. I on an annual basis, I do here dogs, cats, llamas, alpacas, goats, sheep, pig, horse, cow. I've done surgery on a snake here, rabbits, guinea pigs. So that's 10, 12, 15 species. When you talk about a zoo veterinarian, they need to know every animal that's in the zoo, which can be hundreds of species, which is crazy.
Yeah, so seems like there's a lot you have to know to be a veterinarian.
You do. I mean, the general vet school, and even the prerequisites to get into vet school. A lot of what they teach you how to do is how to cram information in, and then extrapolate that and use it to kind of make your best guess. Okay, medicine's not perfect. That's why it's called the practice of medicine, right? Every day I practice medicine. There's no perfect medicine because not every animal reads the textbook, right? So you can, even the most simple thing, you go to do a dog neuter, and you know where everything is supposed to be, and you open them up, and it's not there. Well, what are you going to do? You're just going to close them back up and say, nope, done. No, you can't do that. So your training in veterinary medicine is to teach out, okay, well, I know that they form here, they transition through here, and then they end up here. So I'm going to go in reverse and go looking for whatever it is that you're looking for. So that's training in undergrad training in vet school really just trains you to approach each thing. You can go by the general rules that you have in your head, but you got to be willing to make your best guess and extrapolate information versus just say, well, if it's not in the textbook, then it can't be. Well, that's not what life is. Life is uncertain, and you need to go with the flow sometimes.
Well, how does the community here support you?
Oh, the community's everything. I think we're a bunch of very personable people from the front desk all the way back to the doctors. Most of our clients know that they can call or stop by if they have questions. We doctors, I think when we were walking around, you saw Dr. Schmeltz walking around talking to clients. One of my favorite times is, as long as I'm not too crazy busy, is step out front and just say hi to the clients and make sure that we have that rapport, that it's not just doctor-client thing. It's sometimes you can say, yeah, hi, I'm Jason, how are you? Our clients, they know us, they love us, they trust us, and so it's not uncommon to find someone who just come in and just ask a question and then just chat for a little bit. And we do try to make time for that. Unfortunately, with our busy schedules, we don't always have time for that. But I think a lot of our clients, especially in the close community, for a practice that's been around for 70 years, knows that we're here. Come talk to us if you need us. And that's so important, because without that, businesses fizzle and die. If clients feel completely separated, if they feel that there always has to be that professional division, maybe they won't open up to you. I do try to get to know my clients, because clients both willingly and unwillingly may neglect to tell you something that may be very vital to the case. If the clients know that you really care and you're not going to judge them, then they'll open up and be perfectly honest. Because my hands and my eyes and my knowledge can tell me some things, but maybe I'm missing just one piece of the puzzle that the client needs to fill me in on. But if they're afraid, if they don't feel comfortable talking to us, they're not going to tell us. That can mean everything for success or failure of the case.
Are you kidding me right now? That place was positively great. And Wolf signing off.